Thanks, Mike. And today we're going to look at the system of care ECHO referral process for youth involved with multiple systems. Because this ECHO has been up and running. Gosh, I'm not even sure I know. What year did we start? It was
January of 2019.
Thank you, Jamie, for jumping in there. So we didn't start the system of care ECHO until 2019. I was thinking it was 1 year earlier, but that's great. And and then of course the next year we went virtual. And since that time, we've seen Ohio Rise hit the scene, and things have changed in how the referral processes ebb and flow. In addition, we previously would have long wait lists, and they kept increasing the number of ECHO sessions that we had. And now we have a sort of a lull in referrals, and we're looking at how can we reach out and help people understand both the value and the process of getting involved with us here at ECHO. And I'm not doing this alone. I'm doing this with my colleague, Renne Rodriguez. And Renne, would you like to jump in?
Hi, as Bobbi said, I'm Renne. I'm from Case Western Reserve, CIP as well, and usually in the rotation to be an ECHO facilitator. So I'm generally part of these every week.
True that. All right. Well, thanks everybody for being here, and let's see what we have. First of all, meet YIMS. I don't know if you know it necessarily, but there's a long acronym for our meetings, and it is SoC, which is System of Care, ECHO, which really stands for the learning project that is going on that you're involved in just by being here. And then YIMS, which is an acronym for Youth Involved in Multiple Systems. So we wanted to talk a little bit about what is a typical, if there's such a thing, and that's a little hard to get down to, drill down to. What's a typical youth involved with multiple systems? But we'll start with, generally, we look at youth with an SED sort of diagnosis, severe emotional disorder. And it's just a giant category, really, of any DSM diagnosis for youth. With most of the categories would fall under this. However, it's not enough to just have a singular diagnosis. You really have to sort of demonstrate that you're struggling, that there are some functional impairments, that you're having trouble in some domain or another, like school or home or even community, that sort of thing. Another typical characteristic is that there are usually multiple risk factors. And when we talk about risk versus protective factors, supportive adults, safe environments, those sorts of things. And there are ways to screen and look at those things. But in general, the youth that we see are not just struggling or suffering in one area, but they have multiple risk factors, and sometimes they're a little short on those protective or resilient factors. They may be at risk of placement due to either safety issues or the level of their behaviors and how challenging that is. Skill set deficits and developmental gaps. And honestly, this is it's a therapeutic reframe that, as opposed to looking at some of their issues and problems as issues and problems, we want to look at them as lagging skills. And we frequently recommend the use of an assessment tool to assess for lagging skills and any gaps that might be there. And usually less intensive services were already tried. Just having maybe an outpatient provider or a visit from a social worker, but they're not going to be successful in resolving all of the needs and risks that are there. And that our youth YIMS needs additional supports for success. Renne, anything you want to toss in there?
Excuse excuse me. Yeah, I would say nothing else to add other than to just reinforce that really there's no, typical, there's a variety of issues that definitely prompt youth to be involved with multiple systems. So while there's some patterns, they're all unique and different.
Yeah. Yeah, it's very complex. We couldn't just start tossing in symptoms or particular issues because they're very broad. If you've been with us for more than 1 or 2 sessions, you would start to recognize that. The next slide is about YIMS parents and families. And so how about them? Because YIMS don't live in seclusion or isolated. They start somewhere, and we are very concerned systemically about what's going on with the parents and families. And we find that they often have their own chronic traumatic stressors, and that they are just what it says there, routine, unrelenting, and woven into their daily life. And that significantly impacts their parenting and how they're dealing with their youth. And often the kids that we see have siblings. And so we're not even talking about a singular child there, but multiple kids in that home. Sometimes we see something that we think of as acceleration of typical life phases. So there are patterns of early pregnancy. So young parents, young grandparents even, and occasional skipping generations, and grandparents are parenting grandchildren. It's not unusual to have some kind of family conflict, and coupled with that, low warmth. The feelings of connectivity and support are hard to maintain when there's significant conflict going on. So we try to watch out for that. Parenting skill sets might be unsuccessful in dealing with whatever their current behavioral health or other needs might be. And parents themselves need significant levels of support, not just being told, nope, that's not working, do something different. They need the help and assistance and support as well. It is very common for there to be trust issues with the systems. The idea that if they're under that much stress, and I could easily spin off into trauma training now, but if they're under that much stress, they probably aren't functioning, being their best selves. They're responding out of their stress response system, and their fear, of course, is that their kids will get expelled from school and removed by JFS and hospitalized by behavioral health, and that we have all these controls over them and their children, and they simply don't trust that the system is benefiting them or helping them enough, that they feel threatened by the system. It's the systems themselves. So we may not have engaged as effectively as we could. And finally, they could have some difficulties with service access. Work can interfere with having really high need kids. High need kids can interfere with wanting to stay employed. It's not that unusual a problem. And it isn't unusual that we're dealing with people who may be at the fringes or deeply into poverty. Renne, can I turn it over to you for a slide or two?
Sure. Yep. And I just want to reinforce, as Bobbi mentioned, oftentimes youth and families have multiple system providers. They've been involved in treatment for years, or they've been ordered or mandated a treatment, which doesn't feel good, when folks, outsiders, come in to say, you're doing this wrong or you're not being successful. And it's really, our job to understand that, and then to identify ways to effectively engage them in a better, more collaborative way. And so, which is no easy task. So, which leads us to one of the reasons why we wanted to create this mini training didactic to better utilize the Project ECHO for YIMS. So we have opened up the, referral paths to use Project ECHO. And so you can see here, one of those avenues is through the CME or care management entity. Right now that is Aetna. So any youth can have a CANS completed. I shouldn't say any youth, there's criteria for that, but once they have a CANS completed, that does determine their eligibility and whether they're in intensive care coordination or moderate core care coordination, gracious. They should always be, my gosh, it's passing down from Jamie to Mike to me. Thank you. And so we should be having child and family team meetings, and these should be need to be in person with the child, that youth and family present, and all those providers, so that we can collaboratively support them with a more effective plan. And then new strategies, of course. And then our old, we've always taken them through FCFC. And so there's a link here for both of these. How do you find your CME in your area? How do you find your local FCFC? And that is another avenue. And also to know that I should say myself, Mike Fox, Bobbi Beale, we are also available if anybody else in the community or the spokes has any youth that they would like to refer to us. We will do our best to make that happen. All right. I don't have anything else for that, Bobbi, if you want to go to the next slide, unless you have any additionals.
No, that was great. Thanks.
Okay. All right. So navigating with YIMS. So, like I said, I am so really proud to be a part of this Project ECHO. It's amazing the level of expertise that we have, the final recommendations and the reports that we're able to provide to team leaders and teams that serve youth and families across the state. It's superior to anything I've really ever seen. And so thinking if you are a care coordinator or FCFC worker or someone else in the community, this is probably one of the best resources that you have at your fingertips. And it's free because it's funded through our state partners. So it's really an opportunity to present those complex cases. So if you're working with youth and family that you're really struggling to understand or identify what's going to be the best practice for them, great place to bring it. Also within ECHO, it has the framework of all teach, all learn. And so with this didactic, it's every Project ECHO, they're generally going to be about YIMS. And so those youth and families that you already serve to further increase your education, understanding, access to resources. And it's also a way to come together with like-minded folks to discuss best practices and learn from those case presentations as well. And so our state partners include the Ohio Department of Mental Health and Addiction Services, Department of Developmental Disabilities, and Medicaid. And let's see, Bobbi, anything else that you would add to this?
No, let's jump to the next one because it talks about the ECHO model.
Yeah, and here it is. So these 4 parts that make up the ECHO model, so that amplification. So we want to share best practice and information and knowledge with anyone and everyone who is open and willing to join us and attend. Sharing this information to reduce disparity across the state for those youth and families, and learning opportunities as well, this web-based database. So as mentioned earlier, Jamie said, I should say, because we are a team, but they do provide evaluations and surveys so that we can get your feedback to further inform this practice to ensure that it meets your needs. And yeah, anything else to add with this one, Bobbi? I'm just being mindful of time.
Okay. Oh, I'm sorry. I didn't know it was like a animated slide to click through because I was trying to get to this.
Yeah.
So ECHO supports supports community-based care teams, which really is what we've set up across Ohio, is these community-based care teams in the form of care coordination or in the form of the Family and Children First Councils. And the focus is on using an expert hub team to conceptualize and sort of lead and participate in discussions with learners. And that would be everybody who is logged into this call together, because it expands our capacity to come up with as many diverse recommendations as possible. One of the questions that sometimes arises is we come up with recommendations that you may or may not have access to in different pockets of the state. But that too is information that feeds this process of sort of growing the right services for people in our state and needing to know what's missing where and that sort of thing. So, Renne and I both enjoyed this picture. We like this idea that people get an opportunity to be in a learning community, really, with a broad range of providers and participants, and a group of people who can add some professional or expert level information, but it radiates out into the community. All these little people in the green shirts are people that you go back to your communities or to your regions and your counties and talk to about, let's try this, or we need to access this sort of service. And so this is really designed to do exactly what we need it to do here in Ohio, and it's to radiate that information out and around the state. Renne, did you want to say something about this one?
Yeah. So, and just to reinforce that we have this multi-directional flow of knowledge. And when I join, I always learn something new still as well. So it's really meant to, have that, reinforce that continued learning for all of us. And I think this is actually a great slide to help us understand. So all of the pieces. So we talked earlier about it takes a lot of people in our group to make this work. And some are up front, and then there's lots of people working in collaboration and behind the scenes to make it work. So you can see here those four pieces of the pie, so to speak, that have that continued work to ensure that this is successful. And as we reach out to the community and all the folks across the state, each week we have that case presenter that's going to bring forward a challenging youth and family that they're struggling with to get best practice recommendations and guidance for their work with them. And we are hopeful for in June, we're going to have a handful of teams come back to let us know the outcomes and updates from case presentations earlier this year. So it'll kind of be a full circle. And as I said, we have we have a huge hub and we have many hub experts, so we can meet them.
So this is a list that's posted on the website, the wraparound website, where at least in part, the System of Care ECHO lives. And these are part of our system hub. And we've been discussing that, just as we saw on the last slide, they aren't the only ones though. There's IT and support staff that makes this happen. Renne and Mike and I are your facilitators. Although you see them way more than me these days. And then we have, so the subject matter experts really are these folks right here. And, but it takes everybody to make this happen all the time. And it wouldn't happen if we didn't have all the spokes, all the participants. And it's been a relatively well-attended and popular ECHO. So we have to think that we're getting something out of it, and we try to find out through that data. Here's a quick glance at some of the friendly faces that you've seen on here, but this is definitely only a small part of that list, and we're going to work on expanding our pictures here. But it takes us to the end, which is if you need help with the youth and family, what exactly is the process? And the first thing I would say is you should register for Project ECHO for YUMS, because it's going to let you be part of this community on how to manage complex needs and how to just keep going and learning and trying to be innovative. There's never going to be a singular answer here. You don't come 6 times and be like, oh, got that done. Now I'm great. It's this ongoing, ever-evolving process. Then if you want to refer, if you want to make a presentation, you would fill out the referral form. And this is a hot link to that referral form. While you can't touch it on your screen right now, there'll be a PDF of this presentation, and you can definitely touch it on that PDF, or you can find it on that website, and we'll give you that information as well. This, by the way, this little word here is also a hot link to join Project ECHO. And by the way, if you join it, you don't get hounded by us, and you can attend when you want and not attend when you want. There is no requirement of level of participation. At any rate, you would submit your referral form if you wanted to present a case to either your local CME or your FCFC, whoever you're working with in your community. And then you would have the opportunity to meet with one of us, again, Mike, Renne, or myself, generally, but we do have a few other people who could facilitate to help prepare your presentation. So you're not, you are supported in your presentation. You're not under the spotlight and being picked apart. We want to help you gather your thoughts and your ideas about what is needed. And then you actually do a presentation like we're going to see right now. And after that, we would put together written recommendations. Within 1 week, they would be back so that you could host a team meeting to share with your care team for implementation. That's all we have for today. And because you're the ECHO and we're presenting directly to you, I welcome all the feedback. What do you need more of? What do you need less of? What do you think people need to understand why ECHO is a good thing and why it can be so helpful and why they should either participate or submit a case? Please let us know.